everyone. I'm so happy today I can interview Dr. Dung Thai from the REMD Biotech company. So, hi.
Hi.
May I know your educational background?
Yes, so I'm trained in the United States. I have a medical degree and a PhD from the University of Pittsburgh. I'm trained in organic chemistry and internal medicine. Before I was doing this, I was working in the hospital seeing patients on a day-to-day basis. And then since leaving the hospital, I've devoted all of my time to clinical research and coming up with new drugs to treat disease for patients.
So how many years you working at the hospital?
For the hospital, I worked for, if you include my residency training, it was 5 years.
Wow, that's a long time.
Yes.
So what kind of opportunity you joined this company?
So the company actually has only been around for about 4 or 5 years, but we've been working on this project for almost 10 years. So the CEO and I have started working on the project and when it was at Amgen. And so since that time, we've seen it all the way through. And prior to coming to this company, I worked at another company called Gilead Sciences, on mostly in cancer, actually.
Oh.
Yeah, working on drugs for cancer treatment.
Do you have any interesting story related to this drug development? Drug development is a funny field because most things are known to fail. I mean, you have to expect when you come into it that most things aren't going to work. This is a program that I think, if there's anything interesting about it, is that it has died and been reborn on many different occasions. It saw at Amgen a lack of interest and it was revived, and then I think that probably highlights the most important aspect. I've always believed very strongly in this program, and so when we got it from Amgen, I wanted to be very much involved early on. Do you have any encouragement words for the younger generations? They want to become doctor or scientist of research?
Yeah, I would say that probably the most important thing is to work very hard and remain very curious and always ask a lot of questions about how the world works. It doesn't have to be in medicine, it can be in anything, but I think if you're curious and you want to learn about things, then you pursue that with a passion and it'll take you to where you need to be. And probably the most important thing is that when a lot of folks are telling you that you should give up, you don't need to listen. We've continued on this program, and as a result, it is, it's now got to a point where we think it's going to have a big impact on patients.
Do you have any impressive moment?
I think the most recent moment. So probably the most important thing is that over the last 10 years, we have a strong belief that the biology and the science is relevant for this disease, particularly for the program we worked in. But it's taken us 10 years to the point of getting these results today that we're presenting tomorrow. And the results really upend. It's a paradigm shifting. It's the idea that you can, for almost 100 years, everyone has said you can only treat type 1 diabetes with insulin. And we're showing that, in fact, it may be possible to treat with something else, with the other side. Instead of focusing on insulin, we were focusing on glucagon. So for us, the interesting piece is to see the science unravel within the last 6 months, to see everything that we predicted is coming true.
Yeah, they say if the medicine become development and lots of people can benefit it, and you don't have to bring your medicine every day. You just do the shot like every month.
Once a week. Yes, that's absolutely correct. So the major impact, of course, is that diabetes is getting worse.
Yeah.
And for example, in China and in Asian patients, they're even more susceptible. So the diabetes is expected to get much worse in China, and because Asian
populations, Asian people, tend to get diabetes at a lower weight. It makes them very, very prone. So a drug like this, if you can give it once a week injection, I think would help with compliance, and it's much easier than, for example, in type 1 diabetes, they're checking blood sugars and taking insulin shots 4 times a day.
Wow.
And then in addition to all these, one of the big concerns is that it can cause low glucose. So the low blood sugars can be a danger, and we seem not to cause low blood sugars. And I think that is a major benefit for a drug like this.
So how about the price per unit?
That has not been, we have not discussed that yet. I think that if you look broadly at the insulin market and the type 1 market, we show, the data we present tomorrow will show that we can reduce insulin. So the cost of insulin, if you can reduce that cost, you can make up for it on the price of our drug, and then the potential total cost to patients and to the healthcare system should be not significantly more, but of course with a significant benefit for these patients. I mean, that's an important factor. So I think it's going to be cost competitive, and won't have a major impact on healthcare cost overall.
Oh, did you do the test on animals?
Yes, so there's been a lot of tests, and I think this is over the last 10 years, we've done a lot of experiments. So, I think the joke, and particularly in science, is if we could come up with a cure for animals, we'd be done. But a lot of the times the animal studies don't reproduce in humans, and what we're seeing here is that it's reproducing very well. So the animal studies have shown that we can reduce sugar levels in animals that have type 1 diabetes. So we cause type 1 and type 2 diabetes in these animals, and then we give our drug, and the drug essentially normalizes and brings them back to almost normal.
Do you think the life behavior will influence the healthy issues?
I think for type 2 diabetes, that's definitely true. And this is getting back to the comment I made earlier about the increasing and the rise in diabetes in the Chinese population, because now in China, for example, there's more availability with the rise of the middle class, the availability of food, and because people are eating more, that will increase the likelihood of weight gain, obesity, and getting diabetes. For type 1 diabetes, it's different. It's a disease that is genetic. It's your body attacking your insulin producing organ.
How about the U.S. citizen? Do you think in the U.S.?
That is definitely true. In the United States, and it's very well documented, over the last 30 years, there's been a huge rise in obesity and weight and diabetes. And that's all they link very tightly. And part of it too is that the food companies are much better at making food that tastes good, so people want to eat all the time. And so, if you look in the last 30 years, 40 years, there's been an increase in obesity, there's in childhood obesity, and an increase in diabetes. That's correct. Yeah.
So how about a June 13th event?
Yeah, so we're here to present our data at the American Diabetes Association meeting. It's the annual meeting of the largest diabetes association in America. And the last day they reserve for the president's oral session. It is the most selective and important work that they believe to be impactful in diabetes. So the data that we're presenting today, is in type 1 diabetes, showing that our drug can have a significant benefit in this disease. This is of the several thousand abstracts that were submitted, these are the most selective and the ones that they believe will have a major impact on care in diabetes for the future.
Wow, that's great.
Yeah, we're very excited about it.
So do you have any encouragement words for our new immigrants?
I think that this is a great time in diabetes and in research in general. I mean, if we look more in general, I'm an immigrant as well, so I came from Vietnam in 1975, so I think the general advice would be, and words of encouragement is, this is still a great country where you can come, and if you work very hard and if you're committed, you can do very good things, and you can do whatever you want. You can come off a boat with very little, and you can be a doctor here having an interview about research if you want. You can be all sorts. With diabetes and with things in general, I think we hope that our drug and any of the other drugs out there will help alleviate some of the obesity problems and the metabolic problems that are getting worse in the United States and in China.
Thank you very much. I'm so happy today can interview the Dung Thai. And if you have any questions, please contact him. Thank you.
Thank you.